Hello, America. I'm Dr. Gabriel Buelna. I'm here and your host of Buelna News. It's a online chat room as we're all dealing with the coronavirus and we're quarantined. We're going to be having a lot of chats all the way through Election Day because even though we're going through this pandemic, let's not forget that we have an election and in fact, we have a lot of time to talk about it. So before we begin, I want to talk about what the focus of the show is going to be. So as the United States has entered into a traumatic time because of the coronavirus, President Trump stated, we need to open up the country again for business. The question for America is, when that occurs, will it be under new management? As in, the election is still happening in November, and even if we are all social distancing and or quarantined, the dialogue will continue. That being said, without Latino voters going out to vote to the polls in high numbers, Joe Biden will not win and Trump will continue to be president for 4 more years. A month ago, a Joe Biden representative on cable news was asked his opinion on why Latinos voted for Bernie Sanders in higher numbers. His frankly lame response was, Joe is Catholic. This show will move beyond this elementary statement, and we will hear from Latinos, especially in swing states, that will define what a Latino agenda needs to be in order for Latino voters to come out and vote in at least 5 to 10% higher numbers in those swing states. But today, to start off the show, we have Dr. Sandra Salazar. So Dr. Salazar is an MD. So she would be Dr. Sandra Salazar, MD, works in a major hospital here in Los Angeles, is a trustee at Cerritos College, mother of 2, married, just an overall awesome individual. So Sandra, can you go ahead and maybe introduce yourself, tell us who you are, and the reason we're having Sandra on today is really there's nothing else going on right now except health. And here in Los Angeles, we're in one of the epicenters. And what better person to have than someone who's on the front lines in a major metropolitan hospital? And that's you, Dr. Salazar. So tell us who you are a bit.
Well, again, I'm a physician, and I'm a family medicine physician, but for the last 4 to 5 years, I've been working full-time in urgent care. And now with this epidemic or pandemic, the urgent cares are now frontline as well as any other clinic, hospital, emergency room. So I'm currently working full-time in an urgent care, and where we're seeing patients every day, and we're seeing coronavirus patients.
So Sandra, a few weeks ago, I remember asking you what your opinion, maybe in January or at the end of February, and what was your attitude back then about the coronavirus situation?
Well, I'll be honest, I didn't take it as serious as I probably should have. I did at that time when we had that conversation, the virus was solely in China. I don't believe it had really hit Italy yet, and definitely had not peaked. So I think it was more of a, probably like most of us, well, it's far away, and if it gets here, it'll take a long time to get here.
Where are you at now?
In terms of what?
What's your opinion? I mean, you're not a person, I've known you for a long time. You're not a person that exaggerates, but what's your opinion now?
I'm scared. I'll be honest, as a mother, as a physician, as just a human, I'm scared. And as we see the news, we can see what's happening in New York. They haven't seen the peak. And when it does peak, even probably before that, it's going to come here. So the surge hasn't even hit us yet. Yet our hospitals, generally speaking, are short on ventilators, and our ICUs are almost at capacity. The problem is that we don't have much capacity in our healthcare system. So I saw an article, and they interviewed a Cuban doctor who was sent off to Italy to fight the corona outbreak maybe last week, and he said, I believe he said, if you're not scared, you're a superhero. We are not superheroes. We are revolutionary doctors. So we were trained for this. We're ready, but we can't say we're not scared.
Thank you, Sandra. So right now, how many hours a day are you working?
Well, I only work 3 days a week, but I'm working about 13 hours a day for those 3 days.
Does the hospital where you're working in urgent care have coronavirus or patients who've been diagnosed with coronavirus?
Yes, the majority are in the hospital, but the reality is our numbers are skewed. So when we look at LA County data, we can look at the numbers, we see them rise, but that's only because we're increasing the testing. Yet the testing is still very limited. In order to qualify for testing, you really have to have symptoms, be a frontline personnel, or have traveled to the 5 countries. So if you think about all the people that are probably walking around with the virus who don't have symptoms, we have no idea the number of people who are actually in the community with the coronavirus. So we are seeing patients. I'm sure I've seen many that haven't been diagnosed, and we just don't know it.
So right now, would you say is the hospital calm? Is it? I mean, you're in a major metropolitan area. What city is your hospital in?
In Downey.
And is it calm in there when I mean, because things, I mean, even at 7-Eleven, I walked in to get a coffee a few days ago and they had a plastic shield. I mean, really everything has changed.
Yes.
What has changed in the hospital?
Well, I mean, I don't think you don't sense a feeling of fear, which I'm proud of our staff members who don't really display a sense of fear. And it might be because it hasn't hit home in the sense that none of our colleagues have really tested, that we know of have tested positive. So I think until we start meeting colleagues, nurses, receptionists, and physicians that are testing positive, it might change the climate within our clinic. But right now things are calm and things are quiet. I think people are staying home and really just coming out if they're really sick. We expect that to change in the next couple of weeks, probably the next week or two. We'll probably be having a different conversation at that time. But as of right now, things are calm.
So right now, let me bring up an issue right now. So you had a 17-year-old. I'm not sure if you know who died in Lancaster. Did you know about the 17-year-old?
I read the story. Yes.
Okay, so here's the mayor said. I'm reading the story here. The mayor said that the teen didn't have insurance, so they did not treat him. When he arrived at urgent care facility in the area, the medical staff then told the child to go to a local public hospital. So isn't that dangerous, Dr. Salazar? I mean, for something like that to happen? I mean, Lancaster, for those who don't know, who aren't in LA, it's northern LA County, a little more rural than metropolitan LA. So why do you think that happened? I mean, in a time, President Trump said there's a time of war, so why didn't they take him, in your opinion?
Well, keep in mind when we hear these stories, it's always going to be one-sided, right? So I don't know what urgent care it was and what they exactly told him. What might have happened is if he did not have insurance, they might have said, you do not have insurance, so if we see you, we have to charge you this amount of money, and you probably have to pay up front. But
Dr. Salazar, so I mean, the stimulus bill that just passed the Congress doesn't have money for the undocumented. And if you're undocumented, and I think we have around 11 million individuals who are undocumented, and individuals who don't have insurance, how are our hospitals not paying attention to everyone? Everyone's health is affected. So that's why it's really upsetting to hear this. I mean, is it upsetting to you?
Oh, no, of course. Yeah, that shouldn't have happened, right? He was obviously in distress and needed medical care. And as physicians, our motto and our mantra is first do no harm. So by turning him away, we did him harm, and we might have been able to help him in time. Keep in mind, unfortunately, with our medical system, there's for-profit and there's non-profit. So it's hard to say whether he showed up to a urgent care that was a for-profit. And unless he was willing to pay what they were asking him to, then they would have said, you know, you're better off going somewhere else.
So one of the goals of the shows is we want in November, you know, we've got to get down to the reason of why so many Latino voters voted for Bernie Sanders, right? So as I'm hearing about this teenager that passed away in you know, and really prayers for the family. I mean, because to go through that, I have an 18-year-old, a 19-year-old, and a 21, and it's absolutely horrible. We need to get down to the issue of why he was turned away. Mm-hmm. You know, especially in this time of pandemic. But you've addressed the question, and thank you. It's just upsetting.
Frustrating,
right?
And I can tell you that if he would have shown up to the ER, regardless of immigration status, he would have been served.
You know, but right now, and this is where healthcare is one of the top issues. And as a Latina, so what's your background, Dr. Salazar? Where's your family?
Mexican American.
Mexican American. Okay. So what are you seeing in terms of the demographics in your hospital? Are you seeing immigrants who are not getting attention? Or not getting attention? Are you seeing, what are some of the disparities that you're seeing at the hospital that might help viewers understand maybe some of the health situations here in LA? And as we have these interviews across the country, we want to know what's going on, because we want the political campaigns to pay attention to this and not just listen to national polls, but to pay attention to all citizens and address all of our issues. Dr. Salazar?
Yes, I can tell you that from the patients that I serve, they're working class. They are our janitors. There are our law enforcement. They are our union workers. I can't really say you know, how many are undocumented. If their employer provides insurance, then they're able to come here. I mean, my system's a little different in the sense that you have to be a member. So I can't really give you stats on immigration status, but I can tell you they're the working class of our community.
Thank you very much. So going on to, let's say, your life. So I'm going to be a bit of a chismoso here. Am I allowed to do that?
Mm-hmm. Yes, go ahead.
Okay. Thank you. So how's the virus situation, the quarantine? Again, we haven't seen this since World War II, and maybe no one in anyone's lifetime. How is it affecting you as an individual?
I mean, I think it's affecting me just like anybody else, except I feel blessed that I'm able to continue to do what I love, continue to see patients, continue to help people. There's so many people at home who are unable to work. I'm blessed to have someone that can help me with my children. And my children are home and well taken care of, and that allows me to come into work. But it might be different if I was a single mother and I didn't have childcare. So it affects me like it's affecting everybody else. It's also affecting me because I think just like the staff in the urgent care that I work, and myself and other colleagues, we're frightened to bring something home to our children, to the people we live with. And that's a real fear. And then the problem is not knowing, is not knowing exactly what to do. For example, I went in from pretty much taking minimal precautions a couple weeks ago to then, you know, trying to undress as soon as I walk in the door and take a shower. And now to the point of, now they're saying the virus can live on your shoes for 5 days. So every day is just something more, and just something, you know, it's just more worrisome, right? So it affects me like it affects everybody else, and it affects us because if someone's going to get infected, we're higher risk as healthcare workers. So
as a healthcare worker, tell me how is it? I mean, you have 2 beautiful children, husband. How is it changing your life at home? And not that I'm trying to pry, but I am. But it's important for people to know that healthcare workers are heroes. I mean, you guys are going out there and putting your lives at risk. How is this affecting you at home? Are your children sleeping in different bedrooms? Are you how tell me about some of the daily things.
Yeah, like I said, I've been changing the way when I go to work, pretty much I've changed the routine of what I do when I get home. I make sure all my work attire, I put that in the washer in hot water before I take a shower. I have to take a shower. I've decided to sleep in my daughter's room. So she is no longer in her room. I sleep in her room just to try to minimize that close contact. I don't want to cough on her and then get her sick. And I don't know if I'm carrying the virus. It's possible I am carrying the virus. I have no symptoms, but that doesn't mean I'm not carrying the virus. So I've kind of sectioned off that room, and I've told the children, you cannot go in that room. I'm only allowed to go in that room until further notice. And it took her, try explaining that to a 5-year-old. So those are, challenging conversations. And I think that as a physician, I run against I run into the same obstacles as any other mom, as any other, daughter and worker. We're thinking and kind of changing things as we go. So yeah, I mean, I've had to make some drastic measures. I read something on Facebook on a ICU doctor who is seeing patients that are have COVID, that he moved into his garage in a tent. That's real. If I happen to know that I've been exposed to someone with the virus, I will quarantine myself and not have any contact with my children for the next couple of weeks. I can guarantee you that. So everything is just kind of a day by day. And then now we have to put on the hat of homeschooling our children. That's another challenge, right? Like every other parent who's not used to, I'm not used to teaching my children to the extent that they were being asked to.
Now, that being said, you're also an elected official, correct?
Yes. Yes, I am.
Where?
We just had a meeting today at Cerritos College. We just had a virtual meeting today to discuss online learning starting Monday.
So, moving on to another question. So, what are some of the observations that as an MD, every day, President Trump says that he's a wartime president. I can't imagine that FDR would be behaving this way. How does watching our national response affect you?
It's shameful. And to listen to his press conferences, I listened to one today. It's just inaccurate information. He's downplaying the threat that this virus poses to our livelihood, to all of us, as a nation, as communities. I really admire the leadership of Governor Cuomo and Governor Newsom. I think those are the people to watch. And unfortunately, luckily, we have other leaders to look at, but definitely not coming from the White House. Right now, we're having a national shortage on protective gear for frontline, from people working in hospitals and clinics. There's just a national shortage. And how do we address that?
So you on a sometime regular basis travel to Mexico, correct?
Yes.
Okay. So we can tell you're at home, Sandra. So, or somewhere, wherever you're at. You don't need to identify your location there. So in terms of Mexico, our next door neighbor, here in LA, we're a few hundred miles from the border. And President Manuel Lopez Obrador, and here in LA, we do know the name of the Mexican president, by the way. He has not taken measure, he has not quarantined, and there's a lot of folks that are afraid because in El Salvador, you do have a quarantine. In Guatemala, you do have a quarantine, and you could have a situation that where, let's say, in a month everything's open, and the border opens, then the pandemic has hit Mexico. Mm-hmm. Concerned about potentially what Mexico is doing? Because some will say, well, what does it matter? But I would say, how do you have 130 million people next door, and you have over 300 million people here in the United States. Does what Mexico does, or does Mexico's public policy affect us here in the United States?
Of course it does. This virus knows no borders. And for there to be no policy in place or no measures to be taken, I just saw a video of Mexico City where you have street vendors, you have street performers, you have people walking the parks, people walking the streets. There's going to be a price to pay for that. And the scariest part is that I read and I'm not sure, I can't tell you 100% whether it's accurate, but they reported that Mexico, the country of Mexico, only has 2,000 ventilators for the whole country. If that's true, then a lot of people are going to lose their life because of this virus and because of the inaction of the leadership in Mexico. And at the end of the day, the border cannot be closed for a long period of time. We just went to Baja last week, and I spoke to the Border Patrol, the agent, and he said that they weren't going to close the border, but they were going to practice social distancing by changing, closing the lane, one lane open, one lane closed. But at the end of the day, you would lose too much money or prevent precious importing if you closed it, right? So I don't think it can be closed for good. So yes, of course it's going to impact us. And you have a lot of people working and living in TJ, working in San Diego, vice versa. So that's a real threat to us. And keep in mind, Mexico's a couple weeks behind us, right? So we haven't seen the surge of this virus, and they will be next after us. So when I went to Baja a week or two ago, everything was normal, but it'll be changing soon. Hopefully not too late.
So President Trump said this afternoon that he will be giving ventilators to Europe. And he said, we're going to be giving ventilators to Britain, to Germany, and that's fine. However, I'm thinking, well, what the Monroe Doctrine got your tongue here? I mean, so, it's fine to have all this intervention, but you can't work on a plan to have ventilators for Central America, for South America, for the Caribbean countries, to help Mexico. I'm just wondering, what do you think about that? I mean, it seems as though we have a public policy that says, forget anything south of the border, we're going to go to Europe.
Well, I can tell you that's not going to happen. There's not going to be one ventilator we're giving to Europe or any other country because the need is here. Governor Cuomo has already talked about splitting ventilators, one ventilator for two people. In normal circumstances, that's unethical. It's not the medical way of treating a patient. But desperate situations calls for desperate measures. So he's talking about splitting ventilators for two people. Uh-huh. So if we're already there and we haven't even hit the peak of this virus in New York, what does that mean for the rest of the country?
Okay, so what if you were Joe Biden wants to be president, what would you tell him? And that we'll close with this. What would you tell him with regard to what he should be doing with regard to public health and maybe foreign policy with regard to public health?
Well, what would I tell him? What would I advise him?
Yes.
Well, I think that he needs to be really, again, we need leaders who are going to tell us the truth. The truth might be grim, but it's better to be prepared, right? We have young people, yet, it's good our other concern is mental health, right? So yesterday I went for a walk without my children. I just went by myself around my neighborhood, practicing social distancing. And I walked by a high school. Now, keep in mind, everything's closed. It's supposed to be closed. Yet the track was full of at least 40 people. People in clusters playing soccer, people walking around the track. Exercise is good, but everything we've been saying is just went out the window with the people who were at the high school.
What would you tell them directly? Tell them, if you had a message right now to them, be direct, be specific.
Your life is at stake. This is serious. This is an invisible monster that we can't protect ourselves from unless you stay home, unless you take this seriously. It doesn't matter if you're 20 and healthy. It doesn't matter if you're 40 and healthy. It's not just about people 65 and older. It's about the young people. Now we have the 17-year-old who died in LA County. We have people in their 40s who've died. It's everywhere. I worry about our social, grocery workers. They're seeing hundreds of patients without any protection. If they're also at risk, it's not just about the healthcare workers. Yes, I'm in the front line, but what about that grocery clerk who saw 100 patients in 8 hours with no protection, exchanging money with the potential of getting infected? We had in San Jose, we had a grocery worker who died in her 60s, a grandmother. No one wants to lose their loved one. And I think the best advice is to say, assume you have it, that you have it and you don't want to give it to somebody else. Forget about infecting you. Assume that you have it, right? Because it's going to start hitting home when we start losing loved ones, when we start losing friends and colleagues at work. But then it's going to be too late. We have to really take this seriously and follow what's happening in New York. Just the other day, I had to go run an errand in Lincoln Heights, and maybe that's a question for you. I went under a bridge, and I believe it was Lincoln Heights, and I saw a couple. They were selling aguas, they were selling cut up fruit, they were selling oranges, and I thought, wow. And it really broke my heart, because I know they must be in a really tough financial situation, but they're risking their life. So they're also risking others, right? So they're still trying to make a living, but at the same time, how much is your life worth? But maybe if they don't make money, they won't have where to stay, where to sleep. I mean, these are really difficult questions, but our community is being hit hard.
Dr. Salazar, I want to thank you for being the first guest of the show. Thank you, and
It's an
also
honor.
for being a healthcare worker. And I know the sacrifice that you're doing. And to those who are watching, we want to touch on all the issues. The first show we wanted to make sure was on healthcare, the coronavirus, and to give information and to share with you an individual who is putting her family and herself at risk, not selflessly, in order to help. Thank you very much. And if you have suggestions for the show, you can email me at gabriel@buelnastrategies.com. That's gabriel@buelnastrategies.com. I will see you in the next show. Thank you very much, and be safe, everyone. Social distancing. Don't put your life at risk. Don't put your grandparents and your neighbors at risk. Adios, everyone.